Okay,
Okay, we're
good
good to go.
evening, everyone. Um, Welcome. Thank you for joining us for Ask the Experts, your questions on childhood immunizations answered. This is a program that's been ongoing for several years, co-sponsored by the Montgomery County Office of Public Health and the Montgomery County Immunization Coalition. I'm your moderator for this evening, Dr. Richard Lorraine, the Medical Director of the Montgomery County Office of Public Health. And with me tonight are three outstanding pediatric experts from our medical community. Dr. Stephen Shapiro, the Chairman of Pediatrics at Jefferson Abington Hospital. Dr. Danielle Kasher, an emergency department pediatrician through the Children's Hospital of Philadelphia, and Dr. Michael Harkness, who is a general pediatrician with Nemours Children's Health. We'll start off with some introductions. And as I mentioned, I'm Dr. Richard Lorraine, Medical Director, Montgomery County Office of Public Health. I've had that position for approximately the last 8.5 years. I am an internist by training. I've practiced in Montgomery County for 40 years. And in addition to that, as of 3 months ago, I retired from the Air Force as a colonel. My final assignment was medical group commander of the 108th Medical Group at Joint Base McGuire, New Jersey Air National Guard. And I will turn it over to Dr. Shapiro.
Thank you, Rich. Compared to those esteemed credentials, I've just been a pediatrician in Montgomery County for about the same time you've been in the military and in practice. Happy to be here and participate with the Montgomery County Immunization Coalition, and I've always enjoyed this association to our community. Thank you for inviting me.
Okay. Thank you, Dr. Shapiro. Dr. Kasher.
Hi, everybody. I'm a general pediatrician. I work for Children's Hospital of Philadelphia in the emergency department. I've been in the emergency department for the last 15 years, both at CHOP and at St. Christopher's Hospital in North Philadelphia. Before that, I practiced primary care pediatrics in Roxborough and also in Bucks County. So I've done preventive care and acute care. I have a strong interest in population health and public health, and I'm really happy to be invited to this panel to talk to everybody about vaccines. There's a lot of information flying around, and I know it's really hard to make sense of it all. So I'm glad to be here with two other general pediatricians. We do this all the time, and we're here to answer your questions.
Great. Thank you, Dr. Kasher. And Dr. Harkness.
Yes, thanks very much for inviting me. I'm a general pediatrician. I've been in my current practice for about 34 years. I've been in practice in general for about 44 years, was a hospitalist, and now just do general pediatrics with Nemours. Have been a very staunch advocate for vaccines for a long time, and I'm always thrilled to be able to help parents with any kind of information to help with any concerns they have about vaccines or with any pediatric care, but especially with vaccines. So thanks for having me.
Right. Thank you, Dr. Harkness. So this program this evening is, not surprisingly, focused on back-to-school immunizations for children, but we're going to cover pretty much the entire range of pediatric immunization. It is National Immunization Awareness Month, and that is one of the reasons why we are holding the seminar at this time. The other one being, hey, it's time for back to school. We are certainly at a time when there is a lot of flux going on in the field of immunization and vaccinology, and it's really more important than ever to be able to have trusted sources of information for you to make an informed decision on vaccines and immunizing your children. And as you can see, we have a wealth of experience tonight with our pediatricians on our panel. And the most important thing is to recognize that these are clinicians who work in the community and see patients actively. These are the people who you can trust the most to have the best interest of your child at heart and to have the most up-to-date information. So with that said, we're going to go into our regular program, and hopefully we'll be able to give you the answers to a lot of the questions that have been at top of mind recently regarding immunization. We have 15 questions that we will review that have been submitted to us ahead of time. We actually just got an additional bunch of questions today. So if we have a little bit of time at the end of those 15 questions, we're going to try to squeeze in as many as we can from those and then see where that takes us. So here we go. Our first question is for Dr. Harkness.
Mhm.
And this is one that's certainly at top of mind recently. There has been some concern raised regarding aluminum and mercury in vaccines and any potential long-term effects associated with those. Can you explain why are those present in the vaccines, and is there any specific risk associated with them?
Okay. This is a question that's been going on for a long time. Let me start with mercury. When everybody hears mercury, they think of the little silver balls rolling around in the thermometer. That's not really the mercury that we're talking about. There's two types of mercury that are in the environment. One is methyl mercury, which is the mercury that's in fish and seafood, and that can accumulate in the body. It has a pretty long stay. It stays about 70 days in the body and can accumulate. So it's something that we have to be careful with, especially for pregnant moms and for babies. Ethyl mercury, which was the mercury that was in a preservative called thimerosal, is actually taken out of the body much more quickly. It's usually gone within 10 to 15 days from the body. Ethyl mercury or thimerosal has been used as a preservative for certain vaccines and has also been used in other products, cosmetics, and different things. And it's been used for decades. Because of a concern for the thimerosal, actually, thimerosal is no longer an issue. It's been taken out of all pediatric vaccines as of 2001, just for fears of any potential side effects. So none of the vaccines that we have in our office and that most pediatricians have in their office have thimerosal. There is some in some of the multi-dose flu vaccines, but recently the CDC has recommended not to use any of those anyway. So mercury is not really much of an issue. Aluminum has also been in the news. Now, aluminum is not a preservative. Aluminum is used as what's called an adjuvant. And an adjuvant means that it helps to stimulate the immune response so that a small amount of a piece of a bacteria can actually generate a pretty good immune response without having to expose you to more of the bacteria. Aluminum is a very common element in our world. I mean, on the earth, the most common substances are water, number one, and silica or sand, number two, and then aluminum is third. So there's a lots of aluminum in the soil and the water. It's in containers. We're kind of exposed to it all the time. There is a small amount of aluminum in vaccines. Most babies who get all the recommended vaccines in the first 6 months of life will get about 4.4 milligrams of aluminum total. To put that in perspective, most adults will ingest between 7 and 9 milligrams of aluminum every day. Babies who are getting cow's milk formula, babies that are breastfed will actually get about 7 milligrams of aluminum over the first few months. Formula-fed babies get about 38 milligrams, and soy-fed babies, soy formula-fed, get about 120. Antacids have about 150 to 200 milligrams of aluminum. So the amount of aluminum in the vaccine is extremely small. And just to preserve our confidence in it, there was just recently a study in Denmark that looked at about 1.2 million children over 20 years. And they looked at 50 different diseases, rheumatologic diseases, neurologic diseases, including autism and ADD, cardiac diseases, and they could find no correlation between the aluminum levels, either that were in the blood or that were given to these children, and any of those diseases. So we're very comfortable that aluminum in vaccines is necessary to keep the side effects down and is also very safe.
Thank you, Dr. Harkness. Much appreciated. Backtracking for just a second, I forgot to announce that if you have any questions that come up during the course of this seminar tonight, feel free to type them into the Q&A. Again, we'll be a little bit tight in answering all of the questions, but if there's something that's really important, we'll see if we can get to it. So any questions, go right ahead and put those into the Q&A. Second question is going to Dr. Kasher. Is there an RSV vaccine for children?
So I am so happy to be able to answer yes to that question. Dr. Harkness and Dr. Shapiro and I have all been taking care of babies with RSV for many, many, many years, 30 plus years for me and 40 plus years for my colleagues. So this is something we see all the time. It's a very, very serious infection for infants and also for older people. And I think I can speak for my colleagues, we've all yearned for a vaccine against this virus. This virus is a respiratory virus. It stands for respiratory syncytial virus. Every year, 1 to 2 out of every 100 children will be hospitalized with an infection in this virus. In healthy kids, it can just cause a cold, but in infants, especially premature infants, it can cause a lung infection with wheezing. Sometimes babies stop breathing. Sometimes they need supplemental oxygen or even some pressure put into their lungs to help them breathe. It's also, as I said, very serious for older people, and many more older people die from this infection than babies, but babies are almost universally infected with this. You can't escape it. And a lot of them will get sick enough to go to the hospital, go to the emergency department or their pediatrician. There are sometimes associated ear infections and pneumonia with this, as well as croup. So it's a very serious infection, and it's an extremely common infection. And until 2 years ago, we had no vaccine for this, but now there are actually several vaccines. The ones that babies get are what we consider passive vaccinations. So in one case, the mother will get the vaccine while she's pregnant, and she makes antibodies in her body that pass along to the infant, and those protect the infant. If the mother does not get that vaccine, the baby, him or herself, can get what's called a monoclonal antibody against RSV. So it's not like a typical vaccine where you're injecting the baby with the antigen. The baby's just getting the antibodies, and the antibodies will glom onto the RSV and prevent RSV infection. Incidentally, we've only had this vaccine for a couple of years, but already the studies are showing tremendous effect in terms of cutting down infections and hospitalizations for babies. So it's been very, very successful. There is an active vaccination for, as I said, pregnant women and also for older people. And we are, as pediatricians, strongly encouraging that everybody partake of this vaccine that is eligible. So if you're older than, I believe, 75 or between 60 and 75 and you have risk factors, or if you're pregnant and expecting a baby, you can get this vaccine, and the babies themselves will get the monoclonal antibody if the mother hasn't been vaccinated. So very effective, very safe, and it's really been a boon for us as pediatricians that we can now hopefully cut down on the babies that get very sick from this very common infection.
Thank you, Dr. Kasher. And our third question goes to Dr. Shapiro. This is actually the subject of the last seminar that we did approximately 2 months ago. And a very, very important question. Why does my child need these vaccines if the diseases associated with them are now so rare?
You gave me the easy one, Rich. The story, ladies and gentlemen, begins with what you know happened in West Texas in a population of unimmunized or underimmunized children, and the measles, mumps, and rubella, the MMR story. I do not want to rehash that story. It's a painful one for all of us as pediatricians, because basically, from our perspective, measles was completely, or is as close to completely eradicated as it could be in America for years, because we kept a threshold of protection in every community that was immunized. And as long as that protection level was reached, children remained well. That didn't happen in Texas, and that's the story you know. But I wanted to focus this conversation on the story here in Pennsylvania, which unfortunately, ladies and gentlemen, is sounding very similar to what, maybe not to that extent, but to what you heard and you've read about in the Texas experience. Vaccine hesitancy here in Pennsylvania, vaccine exemptions here in Pennsylvania are very troublesome to all of us in the pediatric who take care of children. They are dangerous because they provide an opportunity for children to be exempted from getting the vaccines that require us to provide a certain minimal amount of coverage. I pulled some numbers from the national data for Pennsylvania, specifically focusing on measles, the MMR shot, and how many children were completely vaccinated. And the percentage of those children was of the kindergarten entrants, about 92.4% had been fully immunized. Another 5.8% did not reach full coverage. And there was a 6% of the children, which is about, in Pennsylvania, about 10,000 children who had an exemption from all vaccinations, which were carried into the school. Another one that you're very familiar with is DPT. DPT has about a 92% completion rate here for the children entering school in Pennsylvania. What is this all about? Well, we know scientifically that you need about a 95% threshold for measles in order for measles to be totally protected for all communities. That's the story in Texas. And unfortunately, as you heard me say, 92% of the children, and probably a little bit less than that, if you take the other ones that are not up to date and the exemptions, have not completed that vaccine package and therefore are exposed. So to your question, whoever asked it, because these viruses and these illnesses are so rare, because we have been able to maintain thresholds for all of the necessary vaccines, the DPT being another good example, and we've seen an uptick in pertussis or whooping cough because that level of immunization is not sufficient to suppress these germs from our populations. So I submit to you that the problem we have that is following the Texas story is not going to remain on the sidelines here in Pennsylvania. We're going to see an uptick in these illnesses, which we already have, but not to the extent that you saw it down in the South. We're going to see this occurring because of some of the other issues that are yet to be discussed on this question list. I want to stop there and just say these numbers are satisfactory for all of us and have maintained the test of time, been maintained to the test of time over the last 40 years of my practice life, such that measles, by example, is pretty much eradicated until you don't maintain that threshold level of at least 95% protection.
Thank you, Dr. Shapiro. And just to amplify a little bit, what we had talked about in our last webinar was the actual severity of all of these vaccine preventable diseases. These are not benign illnesses that in most cases run their course and go away. Some of them can cause severe sickness. And in a lot of cases, it causes hospitalizations and deaths. It is estimated that over the time that we've had these childhood immunizations, somewhere around 80 million hospitalizations and deaths have been prevented. So that's really, really significant. And that's also part of the reason why we want to keep these numbers up. Moving on to the next question for Dr. Harkness.
Yeah.
Should my child get vaccinated if they are ill at the time of their visit?
Okay. That depends a little bit on your availability and a little bit on your ability to come back when they're not ill. The general answer is that usually you can vaccinate. For kids who have simple colds or diarrhea or those kinds of things, those kids can be vaccinated while they're ill. In fact, there's some evidence that the vaccines may work a little bit better if you already have a cold. For kids who are severely ill, if they have a high fever, if they're lethargic, if they're acting really sick, generally you should not vaccinate at that point. It's just too many confusing factors at the same time, and should plan to come back for a later visit. For kids who are on high-dose steroids, kids who have an asthma exacerbation or have some, on poison ivy, steroids for poison ivy, I generally hold off on the vaccines until they're off the steroids. But again, it just depends on whether you have the ability to come back and get them done, but usually you can.
Very good. Thank you, Dr. Harkness. And Dr. Kasher, we have another very, very common question. Is it safe to get so many vaccines at one visit? Can't we spread them out?
Yes, that is a very common question. And when I was in primary care practice, I did get that question quite a few times. I just wanted to add to what Dr. Shapiro said. Dr. Lorraine asked 3 pediatricians who've been in practice a long time to do this webinar, and we've all seen these diseases in our careers that we no longer see, like HIB, which is a vaccine preventable illness, caused very, very severe infection and death in children where their airway would swell up and they would get meningitis. We saw those children when we trained, and we thankfully never do anymore because of this vaccine. So to the question of do we still need these when the vaccines aren't there? What we've seen in many communities, including some countries where they stopped giving vaccines, is the illnesses come back. They're not eradicated from the planet. They will come back, as measles came back in Texas, but diphtheria came back in the Soviet Union when they stopped doing DPT, and other serious vaccine preventable illnesses will rear their heads again if we don't maintain the vaccination thresholds that Dr. Shapiro talked about. As far as getting them all together, the reason we do them all together is that young babies are especially vulnerable. They do not have the ability to fight off a lot of bacterial infections. Their immune systems are just learning. They're immature, and they don't have the strength to fight off some very serious infections. And young babies are especially vulnerable. Their airways are smaller, their brains are developing, and when they get these severe infections, it will have more severe consequences than if it's an older child. And that is the reason why we want to get the youngest babies immunized, and we want them to be immunized as soon as possible. The schedule has been worked out by scientists who've been studying this for a long time and know that it's safe to give the vaccines together. And this way, if we do the vaccines together, we can start protecting babies from those severe infections as soon as possible. Everyone that's protected is another life saved, another family that's spared tragedy or great sadness when their child gets very sick or gets hospitalized. So delaying the vaccines only leaves that child more vulnerable to those infections. So when my patients would ask me if we can space them out or separate them, I strongly advise not to, because for every one that you don't get, your child is susceptible to that infection, and it's just needless vulnerability. In addition, sometimes parents will say, I want to get one today and I'll come back in a month and get another one. And while the vaccine will probably be effective, again, it's delaying your child's protection. And secondly, it's an extra visit. It's more time in the waiting room. It's more expense. It doesn't spare the child anything. Someone actually did a study to see what was more stressful for children, getting a bunch of shots at one time or having multiple visits and having a shot at each one. And as you would expect, knowing children, all those extra visits and extra shots were actually worse for the child in terms of emotional distress. So it's worse for the child emotionally. It's more stressful for the parents and more time consuming and expensive. And thirdly, it renders the child more vulnerable during that time that they haven't been fully vaccinated. So I would strongly advise that all children follow the recommended schedule. I'll just say that there have been changes at CDC, but the American Academy of Pediatrics, which for Dr. Harkness, Dr. Shapiro, and myself is our trusted professional organization, they put out a schedule every year, and usually it is an agreement with the CDC. This year there's some variation, but for those of us practicing pediatricians, we trust the American Academy of Pediatrics and their recommended schedule. And I hope that all the physicians that you're taking your children to are using the AAP recommended schedule, which is safe and effective for children.
Thank you, Dr. Kasher. Dr. Shapiro, would it be better for my child to have natural immunity from getting a disease rather than being vaccinated?
That's a great question also. I think all of us on this panel, and maybe some of you in the audience, have remember from your distant pasts about the chickenpox parties, where parents would try to bring their children together to have them be exposed to chickenpox in classroom settings, so they would get the illness, acquire the illness, get over it, and that's it. Well, today we don't necessarily endorse chickenpox parties anymore or measles parties, even though we can safely say that not every child is going to have a bad outcome. But nonetheless, with vaccines that are so immunologically stimulating, we don't need to think about it that way. So to the question of whether or not natural immunity, going to a chickenpox party, gets you more immunity, the fact has been shown pretty clearly that you're not worried about having the reaction and having the antigen antibody reaction to the illness. You're more worried about getting your memory cells in your bloodstream. Those memory cells have very, very long memories. And our vaccines, our measles vaccine, our chickenpox vaccine, are very, very good at waking up those memory cells and making sure those memory cells have very long-lasting effects for our children. And that's why we as pediatricians can safely say, we'll give your child a dose of measles, mumps, rubella, and chickenpox vaccine at 1 year of age, and then again maybe before school between 4 and 6 years of age, and we can comfortably say to you, it is very, very unlikely that your child will ever have either of those illnesses.
Thank you, Dr. Shapiro. I'll just throw in one additional interesting fact. Now, this is not that common, but it is a recognized phenomenon with measles infections that sometimes it can cause something called immune amnesia, where actually having the disease depresses the immune system and causes increased susceptibility not only to measles, but other illnesses following a case of measles. So there are many, many reasons why we would want to avoid actually having the disease if we have a good vaccine for it and we get the same effect. Sort of along the same lines, Dr. Harkness, are the side effects of a vaccine worse than getting the disease itself? Can you catch the particular disease from the vaccine?
Okay. The answer is no. It's not worse than getting natural disease. There's two types of vaccines. There's a killed vaccine and there's live virus vaccines. The killed vaccines are mainly bacteria and viruses. We take pieces of the bacteria or virus that actually stimulate the immune system. There's no living organism there. It's just pieces. And when we inject that, the body sees those pieces, recognizes them as foreign, makes an antibody, and it does stimulate some immune response. So you sometimes will get fever, you'll sometimes get a sore arm, you'll sometimes feel a little bit fussy as a baby. So we will get some immune response, but you won't get nearly the disease, the types of symptoms that you get from the disease. So some people, when they get, for example, an injected flu vaccine, they'll say, oh, they feel a little foggy and they have a little bit of fever and their arm hurts a little bit. But if you've ever had the real flu, it's not nearly as severe as the actual flu. For the live virus vaccines, and those include a rotavirus vaccine that's given orally, those include a varicella vaccine or chickenpox vaccine, and the MMR vaccine. Those are viruses that have actually been processed through cell cultures. And as you go through a cell culture, as the virus goes through a cell culture, it makes it less and less and less virulent or less and less able to really cause a severe disease. So that by the time you get that vaccine, that vaccine virus is so attenuated, is so weakened, that it really can't cause a significant illness in the patient. Now, it can if you're immune compromised, which is why kids who are immune compromised don't get live virus vaccines in general. But for the general population, the illness that happens from that, you can get a little fever, you can get a little rash, but the illness is much, much less severe than it would be if you had the actual the infection. So no, you can get side effects, but they're significantly less than the disease.
Thank you, Dr. Harkness. Dr. Kasher, what do we know about possible long-term side effects from vaccines?
So the vaccines that we use and that we recommend have been extensively studied. They've gone through very rigorous testing over years. Some of these vaccines we've had for a long time. I mean, MMR has been around since, I believe, 1973, so more than 50 years. So we've really had a long time to determine by studying these things rigorously whether there's an association between vaccines and developmental issues such as autism or fertility issues. I do get the question from many people about HPV and infertility, and that question has been extensively studied and answered, and there's no association between getting the HPV vaccine and having any issues with conceiving. When people want to have children, they get the vaccine as adolescents, they're able to have children. We've had the vaccine now for long enough time to know that there's no impediment. In fact, the HPV vaccine has been incredibly successful in reducing the incidence not only of cervical cancer, but head and neck cancer and other cancers in both men and women. So these vaccines have been tested, they're safe. Really, the main side effect of vaccines is adulthood. Vaccines are so successful, your child will survive childhood and grow up to be a healthy adult. So, I mean, I'm saying that as a joke, but we feel, Dr. Harkness, Dr. Shapiro, and I, we've been giving these vaccines our entire careers, and we trust them. We immunized our own children with all the recommended vaccines. I would never recommend for any of my families anything that I wouldn't give to my own children. And I've been very satisfied that the testing has been extensive, and I feel confident in their long-term safety, short-term safety and long-term safety.
Thank you, Dr. Kasher. A little addition to that as well. When we make decisions and recommendations in medicine, it's on the basis of something that we call risk versus benefit. So we will look at everything that we are recommending, whether it's a medication, an immunization, a procedure, whatever it is. We will look at all the known risks and we will look at all the known benefits. And we do an analysis of that, comparing the risk to the benefit. And if the risk outweighs the benefit, we're not even going to recommend it in the first place. Everything that we do recommend to our patients and to our pediatric patients especially, it's something that we feel the benefit far outweighs the risk. It's certainly worth discussing and looking at what those risks or benefits may be, but understand that we always make that decision with the patient's best interest in mind. Also, by the way, Dr. Kasher has put a couple of great resources into the chat. I think, however, that not everyone is going to see those, so I'm going to repost them and make sure that they go out to everyone. These are some really great sources of information. Moving on to Dr. Shapiro. I think this one's a pretty easy one. Can my child get the flu vaccine if he or she has an egg allergy?
The short answer is yes. But let me give you a little bit of background to reaffirm and hopefully lessen your concerns, ladies and gentlemen. Let me start by saying all flu vaccines, whether the flu mist, the nasal flu, or the injectable flu, is made on an egg-based technology. So small amounts of ovalbumin, of an egg protein called ovalbumin, can enter the process. Yet with our experience, as Dr. Kasher's referred to just a few moments ago, and looking at the data from a very large and very well-respected organization, the Vaccine Safety Data Link, we can actually say with affirmity that anybody who is egg allergic can very easily receive the flu vaccine with no real likelihood of a reaction. However, if you have had a flu shot, and let's say you're not allergic to eggs for any reason, and you have a reaction to parts of the flu vaccine itself, then it's probably a good idea for you to avoid further flu vaccination and think about that with your primary care physician. I pulled a little bit of data from the Vaccine Safety Data Link survey in support of the fact that egg allergy is incredibly it does not contribute to the use of the flu vaccine. They analyzed 25.1 million doses of flu vaccine administered to both children and adults, and the incidence of anaphylaxis, the incidence of a severe allergic reaction to a component of an egg protein, was 1.3 per million doses. That was overall, and then it was just a slightly bit higher for the flu at 1.35 per million doses given. So you can figure those numbers out. If they did 25 million dose analysis, every few vaccines are going to cause a small chance for a reaction. And that's considering only the very most severe anaphylactic reactions that we know can occur.
I'd just like to add to that a couple of things. One is if you get your vaccine in your pediatrician's office, or as was mentioned in the chat of the pharmacy, we are equipped to address allergic reactions. We know how to recognize them. We know how to treat them. We have the supplies in our offices and hospital settings to treat these. So we don't want anyone to think like, okay, it's rare, but it could happen, and then what, But we know how to manage these things. Last year was one of the lowest flu vaccination years that we've seen in a long time. More people were saying no to the vaccine, and we had a very severe flu year. Many children got sick. Many were hospitalized. Many got pneumonia. So back to what Dr. Lorraine was saying about weighing the risks and the benefits, as Dr. Shapiro just said, the risk of harm from the vaccine is incredibly low, but the risk to not vaccinating is actually significant because it's likely that your child will get the flu. And even if they don't end up in the hospital, they're going to miss several days of school. They're going to infect other people, including older people in your family, and they're going to feel terrible. But more importantly, some children got extremely sick and some children died from influenza, which, for us pediatricians is heartbreaking because we know that none of those needed to happen. They are preventable with vaccination, and vaccination is safe.
Can I just add to what Dr. Castro said? I always get asked, what is the right time to give the flu vaccine? And I'll just put a plug into the fact that I gave my first flu vaccine to an 8-month-old baby this morning. We have flu vaccine in our offices where they'll arrive shortly, and you should all of you ladies and gentlemen should pass out to your organizations the information that it's not too early to get the flu vaccine. Flu vaccine, if given on August 19th, will certainly protect you well through the months of February, March, and April.
Thank you both for that. We'll move on to the next question with Dr. Harkness.
Mhm.
So current CDC recommendations for COVID vaccine for children have changed. Should children receive the initial COVID vaccine series, and should they also receive an update vaccine?
Okay. Yes, the CDC recommendations have changed. Unfortunately, a lot with the current administration, and I don't want to get political, but with the current administration, the vaccine experts that have been at the CDC have all been fired. And the recommendations that have come out from the CDC are not really based on very strong science. So we've unfortunately found the CDC recommendation to be pretty unreliable. We've gone back to our American Academy of Pediatrics, who do have the experts that are needed, and looked at their recommendations, which actually just came out today. In terms of the COVID vaccine, if you remember when we first started with COVID back in 2020, it was such a scary disease because people kept dying. Nobody knew what was going to happen. We all walked around with our masks. Since then, the virus itself has changed and has become a lot less virulent. So we kind of look at COVID like it's another cold anymore, which is okay, except for certain high-risk groups. So people over 65 certainly are a high-risk group, but the second highest risk of death is in kids under the age of 4. So we're still concerned about COVID in young babies. They still have a high risk of hospitalization and of death. So the AAP just today came out with their recommendations, and I think they're really good ones. The recommendations are that babies between the ages of 6 months and 2 years should get their initial COVID vaccines, either 2 vaccines if it's the Moderna vaccine and 3 vaccines if it's the Pfizer vaccine, that they should get their initial doses. If you have babies that have had their initial doses and it's been over 8 weeks since their last dose, they should get a booster dose with the vaccine that's coming out this year, the 2025 to 2026 vaccine. So between 6 months and 2 years, it's pretty definite that everybody should remain vaccinated. The older kids, the way the American Academy put it out, knowing that the disease has become less virulent, is that they suggest everybody get it, but that they talk to their physician about it. And if you have somebody in your family or your child's going to be exposing somebody who is also at high risk, they're immune compromised, they have any kind of disease of any of the organ systems, asthma, heart disease, I mean, anything that you would be seeing a specialist for, that those people need to be protected. So if your child has an underlying condition that puts them at high risk, they should definitely get a COVID vaccine. If you're living in the household with somebody who has a high-risk condition, they should definitely get a COVID vaccine. And quite frankly, the safety profile of COVID vaccines, despite what you hear on social media and despite what you hear from, quote, health influencers, the safety data has been incredibly good, incredibly robust, and we have not seen any major side effects from the COVID vaccine. We've seen a lot from long COVID. We haven't seen a lot from the COVID vaccine. So the AAP is encouraging it, and in our practices, I think we're all going to be encouraging it as well.
Thank you, Dr. Harkness. Dr. Kasher, I think you probably addressed this question with your previous one. I'll just ask if there's any additional comments that you have to make. Why are vaccines given so early to young children?
Yes, I agree. I kind of folded that into my first answer, that babies are especially vulnerable because their immune system is still developing. So that's why we give them so young. I do sometimes meet parents who say they want to wait until their child is over a year. And unfortunately, those babies are susceptible to infections and can get severely ill if they're not protected. So I would not encourage anybody to delay those. The older children are, as they've been exposed to more things, they're able to fight off infection. But as Dr. Shapiro mentioned, we've seen an uptick in some of these vaccine preventable diseases, even in older children. This year, I had 1 week that I was working and I saw 4 cases of whooping cough, one in an infant, one in his 3-year-old sibling, and 2 school-aged children, including a older teenager, all of whom had been unvaccinated, and all of them got admitted to the hospital. So these illnesses are in our communities. Measles really illustrated that for us, what's happening in Texas, and we even had some measles cases in Montgomery County. Measles is so highly infectious that if someone with measles goes to Starbucks, as happened this spring, and they go to Starbucks at 10 o'clock in the morning and they're gone, and you go at 11:30 and your baby's not vaccinated, your baby could inhale measles particles and get measles. It's that contagious. So we really want all children to be immunized as soon as they're eligible, which thankfully is birth for the hepatitis B vaccine and 2 months for the very severe bacterial illnesses like pneumococcus and Hib that make babies so sick. So that's why we do it when they're young, because that's when they're most vulnerable.
Thanks. Thank you, Dr. Kasher. Dr. Shapiro, just before I read this next question to you, I will remind you that we are limited to 1 hour forum here. So please keep our time constraints in mind. It seems like attitudes at HHS and CDC regarding vaccines and immunizations have changed recently. Has this changed either your recommendations or the way in which you discuss vaccinations with parents?
You're absolutely right, Rich. I will limit my conversation to the last question asked in this last sentence in this question. Nothing has changed and I'm going to also say my colleagues' recommendations for vaccination to anyone about what is necessary for children. I think that parents today have to look at and begin to try to recognize falsehoods and recognize misleading conversations. Ladies and gentlemen, we're living in a world where the social media can take a simple comment and explode it across the world in a matter of seconds. A good example of it is a comment that I heard when all of the HHS and the CDC leadership was turned over, and the ACIP leadership was turned over. It was a commentary about how these pediatricians, these specialists were being paid to give vaccine information, and their honesty was being thwarted by their fees that they were collecting. Nothing could be farther from the truth. These are the world experts sitting at a table giving pediatricians like the three of us the world's best information under the most critically analyzed and multiply reviewed services. So I will say to you that you need to be aware of, because of what I just said, that there really has been no change in my practice life, in my colleagues' practice lives, from what we know is best practice to recognize the falsehoods, recognize emotional manipulation. Fear is a powerful, powerful tool. Urgency is a powerful tool. Someone coming to you with an urgent comment who is a superior can be very influential. Cherry picking data happens in this unfortunate counterculture, by taking data and manipulating it to make it sound like vaccines are harmful. And then just the idea of false experts coming along and making profound statements are very painful for all of us who live in the world of healthcare delivery for children on an honest basis. You need to remember the Montgomery County Immunization Coalition is a strong location for the facts. The American Academy of Pediatrics, which has already been mentioned, and other organizations that meet to the test of time as as being reputable for what you need to know. Dr. Kasher published Healthy Children as a reference. There's the facts right in front of you. I'll stop there and certainly ask any follow-up questions. But ladies and gentlemen, we're under siege now for the health of the children of the next generation. And we can never forget that. I know I don't. I know my colleagues on this panel don't every day. And it breaks my heart when I hear people refuting my advice for what it's worth, refuting the facts, my own personal use of the vaccine in my family, my extended family. It it breaks my heart. It just does. And this is a hard situation for you as young parents to be in. I respect it, and I hope you'll always be able to come back to us, your primary care physicians, for the answers, the true answers to your questions. And I'll stop, Rich. I apologize if I took a little too long there, but
Thank you, Dr. Shapiro. Dr.
Can I
Harkness,
just
think.
add to that very briefly? The two resources that I put in the chat and Dr. Lorraine published as well. for the Children's Hospital of Philadelphia has an excellent vaccine education center, and I put the link for that. It's in plain language. It's for regular people. Doctors can use it, of course, but it's very readable to people who aren't doctors. And it answers a lot of questions about vaccine safety, goes through all the vaccine preventable illnesses. It's a really great resource. And similar, healthychildren.org is written for parents. It's not for clinicians. So very accessible for people with questions.
And the Vaccine Education Center at CHOP takes no money from any pharmaceutical companies. They're not in anybody's pocket. These are just experts.
Thank you. Thank you. In the interest of time, the next question was for Dr. Harkness, but I think it's been pretty much addressed. How do I know if vaccines are safe for my child to receive? We've talked about the studies that have been done, particularly looking at the preservatives and the adjuvants. So I think we have addressed that question. We'll move on to the next question for Dr. Kasher. Isn't it true that better hygiene and nutrition were responsible for decreases in disease rates and deaths rather than vaccines?
No, it's not true. And Dr. Lorraine, you quoted a study, I think you and I read the same study about the number of infections that were prevented with vaccines, around 100 million. So certainly, improved hygiene and having public water that's sterilized, that's been very helpful. We're not seeing, cholera outbreaks in our country, but it's not sufficient. I mean, without vaccines, we would still be getting a lot of infections. We had hygiene, and we were still seeing pneumococcal disease, children dying of pneumonia and meningitis, and Hib infection, which I mentioned. Measles certainly is not killed by washing your hands. So they're both important, as is, good nutrition and getting enough sleep and exercise and not smoking and wearing a seatbelt. All those things are important. Thankfully, we have vaccines in addition. So if we only had hygiene and we didn't have vaccines, we would still be seeing a lot of these infections.
That's a very good answer. That was a very good answer.
Yeah. Thank you, Dr. Kasher. Also, our next question, I think, has been addressed.
I covered it. Yeah, I agree with you.
So the next question that we have, which was for Dr. Shapiro, there's a lot of information and discussion of vaccines online, particularly in social media. Where can I get reliable, factual information? Well, thanks to Dr. Kasher, we've given you two excellent, unbiased scientific sources that are specifically written for the lay public. So those are the main areas where we would recommend information. I think Dr. Harkness has something else he's going to send us as well. But the most important source of information I will point out is really right before you this evening, and that is your child's pediatrician. That is the most reliable source of information. These are people who, I think we have seen that attitude come through tonight. They are devoted to what they do. They are devoted to the care of children. And their primary interest is in the well-being of your children. They have the background and the knowledge and the scientific expertise to be able to review the latest information and to boil it down into an understandable answer to all of your questions. So your best source of information, bar none, is your child's pediatrician. So there are many other factual sources. As I always told my patients when I was talking about looking for information online, never ever Google something, with apologies to Google, and I have a nephew who works for Google. But there's a lot of sponsored links there. There's people who know how to get lots of hits. Your best bet is to go to a reliable source, a reliable site first. Cleveland Clinic, Johns Hopkins, one of those reliable web sources, then use their search engine. So don't use a general search engine to start with. And so we're running a little bit behind schedule. We'll try and get a little bit to this one question, and I think we actually already have addressed part of this as well. the elephant in the room is the measles outbreak, particularly in Texas. And we've alluded to this a little bit, but I wanted to put it out there for all of our panel here to discuss how effective actually is the measles vaccine. And the other thing that has come up with this, is there anything that parents can do if they have a child under the age of 2, since that's when children start getting their MMR vaccine? If they're going to be traveling to an area where their measles is endemic, is there anything that they can do to try and prevent that? And I'll just open that to the entire panel.
Yeah, I'd love to talk about that first. Yes, for the longest time, the thing about measles vaccine is we get 2 doses of measles vaccine, really because the first dose is only about 91 to 92% effective. And the second dose actually brings the effectiveness up to about 98 to 99%. 92% is not enough to prevent outbreaks, 99% is. If you are traveling, so if you get 2 doses of measles vaccine, you're very well protected. If you get 1 dose, you're pretty well protected. If you're between 6 months and a year and you haven't gotten any measles, mumps, or rubella vaccine, which we don't usually do before a year, and you're traveling to any place that is endemic for measles, meaning there's a high amount of measles, and that means Mexico and Latin America, that means Africa, that means Asia, that means basically anything but United States, Canada, Western Europe, Australia, and New Zealand. If you're traveling to any of those places, you should get a single dose of MMR vaccine. You should get a single dose of hepatitis A vaccine. Those will not be counted towards the vaccines later, because sometimes with the measles, mumps, and rubella vaccine, the moms will have antibodies in the babies that have crossed over to the baby and in their systems till the babies are about a year. So we're not sure how reliable that MMR is, but it's a great way to protect your baby if you're going somewhere. Unfortunately, all those countries that I mentioned, West Texas is now another one of those places that you should consider getting it. Although, as of today, since it's summertime and we expected this, the measles outbreak in West Texas is now considered over. There hasn't been a new case in about 6 weeks, which is the definition of it being over. We're all kind of on the edge of our seat wondering what's going to happen when November comes around and measles is back in the community.
It's a great answer. I have nothing to add other than I was just thinking about the polio epidemic that we had right in Lancaster County a few years back. And our health department came in and immunized that population with alacrity, with speed, with efficiency, and with no doubt. They told the folks, this will save your children's lives. And it was very effective in eradicating the polio epidemic right here in our own Commonwealth.
Well, with that, I think we're going to bring the question section of our program to an end. There are a number of questions that were submitted, and there's also an additional question that was submitted this evening that we did not get to. We will put together answers to those questions, and I am right now going to send out the link to the Montgomery County Office of Public Health website for immunization. So the answers to those questions will be posted on that website. So for those of you who submitted questions that we were not able to get to, we will post those answers on that website, so you will be able to see them. And I'll just go at this point to our panelists for quick closing comments. Dr. Harkness first.
Yes, thanks very much for attending. Please know that we understand that the information out there is very confusing. We understand that you really just want to protect your child. We're on the same team. That's what we want to do too. We didn't go through all those years of school and all those years of practice to do something to harm your child. We're out to try and protect your child as well. And we want to be on the same team, not just on vaccines, but on feeding and on all kinds of other childhood issues. We're on your side. So please let us help you get through some of the information that's confusing to you. Please, allow us to be the source of information for you.
Thank you, Dr. Harkness. Dr. Kasher.
Thank you, Dr. Harkness. You said that so well. And Dr. Lorraine, I really appreciate the encouragement of families to trust their pediatrician. We treasure that trust that you have in us, that you bring your most beloved children to us for our care. So it's really a very special relationship that we form with our families. And I agree with everything Dr. Harkness said. I couldn't have said it better myself. We are on the same side. And we know that there's a lot of information out there and how confusing it is. I hope that some of the resources that we shared tonight that we trust will be useful to you.
Okay. Thank you, Dr. Kasher, and Dr. Shapiro. Take us home.
Thank you. Thank you for the opportunity to participate with my esteemed colleagues and on this panel. I just have one anecdote to add. Mike said it beautifully. I don't need to repeat those words, ladies and gentlemen, but I do want to give you one anecdote. In the back of the doors of my exam rooms, we were fortunate to get a poster of pictures of various immunization related diseases that have been virtually extinguished from our day-to-day lives as a result of vaccines. And it's interesting, children will often look up at them and say, "What are those pictures?" Well, those pictures, and I say this very calmly, I said, these are pictures of children who had illnesses that you don't have to worry about because you've been vaccinated for them. And there's like a pause in the room. The mom doesn't say anything or the dad doesn't say anything. And that's the end of the conversation. It lasts a millisecond. But ladies and gentlemen, that's what we do for a living as pediatricians. Make sure that none of those pictures ever come to to enter any of your homes or your families. And that's all it's about for us. We care deeply about our responsibility. And as Mike said, you can trust us. We don't have any skin in the game. Our only skin in the game is to keep your kids well. And we're not paid to give these vaccines. That's for darn sure. So keep that in mind as you ask your questions and listen to us give you sound, fact-based answers.
Thank you, Dr. Shapiro. I would like to offer special thanks to all of our panelists for this evening. I thank you for taking the time to share your knowledge, expertise, wisdom, and caring with our audience in Montgomery County. Also, a special thank you to Caitlin Tucker and Teresa Harris from Montgomery County Communications Office for providing the technical assistance with this program. The program has been recorded and will be available on our website. You can use the link that I did post in the chat, and that will be available hopefully within a couple of days. My final comment is that we recognize, as my colleagues have said, we recognize there are many, many questions about immunizations these days. There is nothing wrong with asking questions. We encourage you to ask these questions. One of the most important things that we can do is answer your questions. And we want to provide this information to you in an understandable way and an unbiased way. So please feel free to ask these questions rather than avoiding immunization. Definitely ask your trusted pediatrician. I thank you again to all of our panelists. Thank you to our audience for joining us tonight. I hope you have found this illuminating and helpful, and I wish you all good health and good night.
Thank you.